This video is part of a series of short forums Time Citizen and KIFG are hosting between candidates in contested local races for the upcoming general election on Tuesday, November 3rd. I'm Tony Baranowski, Director of Local Media for Time Citizen Communications in Iowa Falls. Our intention is to post these videos on our website at timecitizen.com and to broadcast the audio on KIFG well ahead of Election Day because so many people are voting absentee this year. Joining me today via Zoom are the two candidates for Iowa House District 50, incumbent Republican and now Speaker of the House, Pat Grassley, and Democrat challenger, Dennis Evans. At this time, I'll turn it over to Pat to introduce himself, talk a little bit about his tenure in office and what he views are the important issues right now and on the horizon for the district and for the state of Iowa. Take it away, Pat.
Thanks, Tony. Appreciate the opportunity to be here. And if I lose signal or anything like that, just stop me anytime. So that'll work good. But thanks for the opportunity to being here. Pat Grassley. Just finished my 14th year in the legislature. And as Tony said, was elected speaker about a year ago this time. It's really been quite a interesting session to have my first one between COVID and everything else that's been going on in 2020. It's been a very unique time to become speaker, especially in your first year. From New Hartford, so the district, House District 50 is southern half of Butler, all of Grundy, and the northern half of Hardin County. And so I've represented this since the redistricting process took place 10 years ago. Issues that I think that are going to continue to be topics of conversation, and I think some of them just tie in with what's going on in the world today. A perfect example would be the budget situation. I was chair of the Appropriations Committee for 4 years. We have, in my opinion, passed a very, very responsible budget every year. When we inherited the majority 10 years ago, we were in a situation where we had about $1 billion deficit. We've turned that around. Our cash reserves are full. Our rainy day funds are full. We have an ending balance. And so as a past appropriations chair, but I think it's want to get very clear to all the listeners, the number one responsibility the state has and the legislature has is passing a budget. It's the only thing we're required to do before we go home. And I think that our caucus takes great pride in that, that we've passed budgets that left us in a situation where we could maintain our funding to education this year, an additional $100 million. So moving forward into next year, obviously K-12 education and the funding that goes with it is going to be a huge topic, but again, ties back into the budget. Thankfully, we were just voted by the Council of State Governments as the #1 most prepared state in the country to handle COVID from the standpoint of budget. And so I know I talk a lot about that, but if you look at almost every other issue that comes up and probably will come up during this conversation, ties back into the budget that we have here in the state. And so I take great pride in that and the responsibility or the responsible budgets that we've continued to pass. I think we're also going to look at issues, making sure that we have continued input from parents when it comes to K-12 education. So again, the K-12 funding is always a big issue, but I think we're gonna have more conversations around things like open enrollment. We've had a lot of school districts, not necessarily in our area, that chose not to go back in person. The legislature made a very clear decision that there needed to be a 50+1% return in person from the school districts. And we had a lot of parents that I think that are been left in a position where they couldn't go to a different school and have the opportunity to go to one of the surrounding school districts because of the open enrollment process in the state needs continued work. So I think you're going to see a lot of conversations around education because it's been a hot issue. I can tell you from everybody I'm talking to right now, they're very thankful that we're going back. Our school districts are doing a great job, especially in House District 50 of getting kids back in the classroom. The teachers are doing the great job, the administrations and the parents. So budget, school funding, those are going to be two big issues that we continue to look at. And I'm sure there will be many more that not only the governor brings to us, but I would say those two are probably the ones that tie in and that are the most talked about right now and what the impacts of COVID and then the impacts of decisions the legislature makes as far as what school districts and attendance in the future looks like.
Great. Thank you, Pat. Now let's hear from Dennis. Mr. Evans, could you tell us a little bit about yourself, your history as a candidate, and why you decided to jump into this race?
Okay, my name is Dennis Evans and I live in Rhinebeck. I'm a retired banker. I have over 40 years of experience as a trust officer. For a lot of people, they don't know what trust officers do, but from my perspective, a trust officer is, he is a family planner, an estate planner, wealth management, deals with people who have kids that have issues, planning for the future. And so to me, it was a perfect fit for deciding to run for office because as a trust officer, I dealt with taxation. I dealt with um, so many issues that families have to deal with. So while we have people passing all the laws, I had to deal with all the laws on the other side. And so that's, uh, it gives me a perspective that is a little different than being the one who's passing all the rules. So I thought it would be great to be able to have the opportunity to have some feedback into that. I'm married, I have 4 sons, and I have almost 8 grandchildren. I have one due in another month. And family is probably the biggest part of my life. And one of the reasons I decided to run is because I want to be able to tell my children that as they grow up, that if the issues that I have and that I want to talk about are issues that could make a change in their lives. And so that's a big part of why I decided to run. Um, I grew up in a family that my dad was an Iowa Democrat or Republican, and my mom was a California Democrat. And so my entire life, I've dealt with the 2 different sides of a lot of questions. And I think that's important because as I've been calling and talking to people on the phone, because with the coronavirus, I didn't think it was appropriate to knock on doors. And one of the biggest issues that I hear from people is that they're tired of the 2 parties always fighting and not coming up with solutions and talking together. And that's one of the concerns I have with Iowa today. And for Pat, it's a great deal because the House, the Senate, and the governorship is all controlled by one party. So the debate is always their side of the debate. And I don't think that they hear what the other side is asking and want to talk about. And so I think it's important that not one party controls all gambits of our legislative process. And in order to do that, we have to get out and be willing to talk to people and to get them to vote for us. And so that's again why I'm running. Besides having a career as a trust officer and having been a teacher at the very beginning of my career, I've also been I've been active in my community volunteering for the Alzheimer's Association, the local nursing home, Dollars for Scholars. I'm a ship counselor at Grundy Hospital, so I'm helping people figure out their Medicaid and Medicare and how all those things work. And it's so complicated for them. And I deal with people who are trying to figure out if they're going to be buying drugs or if they're going to be buying food. And so those are the kind of questions I have dealt with. I also am a volunteer for Iowa Project Aware, which was originally funded by the DNR, but now has gone nonprofit because DNR cut the funding to it. But we cleaned 61 miles of river from Goldfield, Iowa down to Webster City and hauled almost 36,000 pounds of garbage out of the waterway. And so I think the environment is an important thing that we need to be talking about. But what concerns me about the process that when we talk about these issues, automatically everybody gets one side or the other. We need to be pulling people together so that we can come up with solutions that both people can accept. And again, that goes back to what a trust officer does. That was what my role was. So that's me in a nutshell. And so if we want to move on, that'd be great.
All right. Thanks, guys. And you both touched on quite a few different issues as you were introducing yourselves. Hopefully, we can get a little bit more specific with these questions from some from my staff here at Time Citizen and some from our listeners and readers. The coronavirus pandemic has laid bare a problem that Iowa families have known about for years. There is a shortage of quality, affordable childcare in Iowa. This issue affects families, but it also affects businesses in the form of workplace attendance. It affects communities' abilities to grow and attract more jobs, and it affects children who don't get the kind of engagement and attention they need. What role should the Iowa legislature play in addressing this need, and what can be done? we will let you start things off, Pat.
Okay, well, I appreciate you bringing that issue up. And I did not submit the question for that one, but that's a good question I like to get. Again, into my past role as appropriations chair, starting 2 years ago, our caucus, which 2 years ago became a much younger caucus. And I mean that from the standpoint of, yes, we had a lot of new members, but a lot of the new members that came in were members that have young children, that have friends who have young children in the daycare and the child care setting. And one of the issues that our caucus and our party, quite frankly, as Republicans, would have historically not talked a lot about was childcare. Now, I can say from the standpoint of where our caucus stands today and what our party's looking at, hearing from Iowans and listening to their concerns, we passed several pieces of legislation over the last 2 years. Now, not every one of them made it to the governor's office. Several of them stalled in the Senate, which clearly I wish would have gone further and will continue to push for. But we have an issue that's a bipartisan issue. And that's the one thing that I want to say. Over 90% of the bills that the legislature passes are in a bipartisan fashion. So I just want to make sure that the listeners understand that we're not like Washington, D.C., where all you hear is the bickering and the frustrations with not listening to each other. When over 90% of the bills pass in a bipartisan manner, and I got a fly flying around here today, so bear with me. But when they pass in a bipartisan manner, I think we're doing the job that I was sent there. But back to the child care question, a perfect example would be you have something called the cliff effect. It's an issue that's been talked about for years in the legislature, but it's a very expensive problem. And it's basically that if an individual wants to go back that is on assistance from the state or the federal government, once they take a job, they immediately, if they reach a certain wage threshold, immediately lose all their benefits. That was something that in the House this year we've worked on. We found room within our budget. Now, obviously with COVID, that kind of derailed the end of session. We were getting to the point in session where a lot of those types of issues were going to move forward much quicker and be part of the entire or the final discussion we had to wrap up session. But that's a perfect example of the cliff effect. Something that impacts Republicans, Democrats, Independents, everyone and above, something that we've taken a lead on in the House is a perfect example. We've also, in the House, taken a vote to double the eligibility for the child care tax credit, which taking that from 45 to 90,000. Looking at it from the standpoint of how can we not only provide access to those folks that are going to hit the cliff effect, but how can we also give some assistance to working families as well? Because up to 45,000, if you have two people working, even just a regular job in the state, you're probably going to eclipse that. So we've doubled the child care tax credit efforts in the House and the eligibility. So I think that's another big issue. And we've also taken a look at the other side of it, which it's not just about the cost, it's also about the providers, the facilities, the workforce. So we've really tried to push any of the programs that we have through our community colleges in which we can include incentives to be able to be used on childcare. Some of those don't reach the wage thresholds that are needed. So we've tried to adjust the rules and make sure that they can, because we realize you have to have a workforce. And then we've also tried to pass incentives that would allow the local communities and then those folks that want to open our childcare facilities to be able to use some of the resources. I know a lot of communities are taking a lead on trying to do that, working in a partnership, a public-private partnership, I would say, recognizing the need that exists within the community. But again, it's about cost, it's about accessibility, workforce. It has several different components. And like I said, we passed several pieces of legislation in the House over the last 2 years to try to address those, and we'll continue to work on them because we hear from Iowans how important that is.
Okay, Dennis, what do you feel about this issue? And do you feel the state could do more, should do more? If so, how?
I live in Rhinebeck, as I said before. In the last 3 years, we built a facility that is attached to the school itself. And it has added so much to our community, and it's added to families moving into our town. But it was funded in a large part by the city, which had received a donation from an estate, and so they used a lot of the money for that. It was surprising the conflict that they had. They had certain family or members of the city who argued that it shouldn't have been used for that. But I think it's shown that it's been very positive for the city of Rhinebeck. I do believe that when you look at education, I taught back in the late 70s. The way our schools are set up is the same way that it was back in the 1800s. We had kindergarten. They went from kindergarten to 8th grade basically in those days. I think we need to address and look at how education is functioning. We're asking for our schools to provide more and more services at all sorts of different levels. My wife had been a special ed teacher, a kindergarten to 1st grade special ed teacher for many years, and the issues that she had to deal with were so complex, and she didn't have the support that she probably should have had from the state in what they're demanding. Between the IEPs, she spent almost every night at home working on her IEPs that she had to create for the students. They had no time at the school to do that. So I think we need to look at how our entire school system is functioning. I think this is a long-term thought process that we need to go through. In banking, we always had a 5-year strategic plan, a 10-year strategic plan. And I think as a state, we need to have a strategic plan to be prepared for the changes that are coming into our education world. When you look at what artificial intelligence is going to do in the future, how are we going to be prepared to help our people in our community be prepared for that? And how are we going to use it to make our school, maybe use it as part of our education system as well? So I think we need to be looking strategically into the future and how we're going to deal with the school processes and the preschool issues, but it's going to require us to work in cooperation with the schools and within the parameters of the legislative process as well.
Okay, and this is a little bit of an extension of that. We were talking about childcare in the first question. This one is more about regular public schooling. This year, the Iowa legislature approved spending an additional $85 million on aid to public schools. That's a significant amount, but still less than the governor and Senate Democrats proposed. School districts in rural Iowa have faced several years of declining enrollment, which affects the amount of money they receive from the state. What's the solution? Can and should the state allocate more money for public education in Iowa? And what do you say to districts that are looking at funding increases that barely cover the increased costs of educating students? We'll start with you on this one, Dennis.
When we look at the future of education and how much it's costing to educate our children, for example, in Rhinebeck, our busing budget is but with education, it comes from different funding, the building and the actual education process. I'm aware of that. But as we look at how we're spending funds and how we're looking to the future, we've got to have a strategy that allows the school to make some of the more of those decisions, I think, in the process of how they use those funds. I think every dollar that we spend, we get a return on, and we need to consider that. And I think Pat will support this thought process too. I think that it's how, what is our priority? Is it to educate our kids or to just get through the day? And I think a lot of times that's what we see with the education process.
Pat?
Yeah, so the first thing that I would say to the question, Tony, would be if we followed the House and Senate Democrat budget proposals, we would have voted for an additional $3 billion worth of spending, which as COVID hit this year, I can guarantee you the first thing that would have been cut would have had to have been schools and Medicaid, because they would have been an unsustainable. So anytime, just comparing what has been offered and what I've seen over the last 10 years, is just $3 billion worth of spending increases, we would not have been able to be the #1 state prepared to have a COVID response. And I would also say, from that standpoint, I think that our caucus takes great pride in the last 10 years. We have always maintained our funding levels whenever we passed, even if someone did not agree with the levels that were recommended. The House caucus has always been able to follow through with that commitment that we have made. When I was in my first 4 years in the legislature, we saw 10% across the board cuts on K-12 education, in part because of over-promising and being able to under-deliver. So the first thing I'll say is we've always been able to maintain that commitment. Not everyone agrees with the amount, but I've heard from so many people, once you make a commitment to us, make sure you maintain that. And that's what we've done. As far as the amount of money that's gone into schools, one thing that we have done in the last couple of years is we've added additional resources into for our rural school districts, and not just the rural school districts, but more of the school districts that have the higher cost of transportation. So we have begun to bring down that inequity to get everyone at the average within the state for the cost. So what was happening at some school districts whose costs were twice and 3 times more than other school districts, which obviously was a drain on their budget, and a strain on their budget, I should say. So we put money into K-12 education through the SSA, through the funding formula, as well as putting additional resources into transportation costs based on getting everyone to the state average. And we've also begun to buy down for property poor school districts because there's a property tax inequity all across the state. You hear about it a lot from the Davenport, Scott County school districts, but we've begun to put additional resources into trying to level that inequity. Now that one is a much more significant dollar amount that's taken years and years to get to the point where we're at. So that one's a little bit harder to get everyone to the average, but we've been able to get everyone to the average when it comes to the transportation costs. And I just remind everyone that listening, it's easy for everyone to say, or, Republicans underfund education, House Republicans never give enough money. 2 things to that. Almost half of the entire state's budget, we're at about $8 billion, just under. Nearly half of the entire state budget goes to K-12 education. And by the time you add in Medicaid and the courts, you're up around 90%. So 90% of the budget goes to those 3 items. And so I just am always reminding everyone, the amount that we decide is not based on any sort of political agenda. It's an amount that we know that we can fund into the future. And that is a commitment that we can not only make a commitment, but keep that commitment. And the last thing that I would say on this, and this is more of a frustration that I have seen over the last several months, is for the last 14 years, it's always been the Senate Democrats and House Democrats saying Republicans never do enough for education, never do enough for education. We need more resources. We need to be in school. We need to support school. I can tell you right now, as I sit here, the leadership from the other side, if they were in charge, our kids would not be back in the classroom on a daily basis, or at a 50% level, or a hybrid learning. We'd be in a situation where I don't think the school districts would be reopened. If you look at a lot of the statements that we've seen since the governor made that decision, working with the legislature, we passed the legislation, and then she's made sure that it was followed through the Department of Ed. If it wasn't for the leadership of someone like a Kim Reynolds, I don't think we would see our kids back in school. So I think that's something that, as a Republican, we need to be very proud of, because I can tell you all across House District 50, I'm hearing great feedback, and our administrations, teachers, parents, kids are doing a great job of making it work in these difficult times. So I'm very proud of what we've done and what our record looks like from our House caucus.
Thanks, Pat. And just one quick point of clarification on that. I know you were talking about what the Democrats requested. The governor actually requested more funding than you guys approved last year as well.
And I actually, so from that standpoint, I also and I would have to double check on this. I don't know if the governor went to the same levels of transportation and inequity funding. So if you tie those 2 together, I think we're at much closer of an amount. I think that may be where the disparity is in true SSA versus our caucus felt it was a priority to fund SSA, as well as funding the property tax inequity and the transportation inequity.
All right. Thank you for clarifying, Pat. All right, let's move on from education. Many rural hospitals in Iowa are struggling to stay afloat. Inadequate reimbursements and changing trends in patient care have affected how critical access hospitals make money. As a result, services have been cut. In many places, that's been OB, forcing women in rural areas to drive an hour or more to access prenatal health care and to deliver their babies. This affects the health of Iowans who live in rural areas, and it affects the viability of our rural communities. Who wants to move to a town that doesn't have a hospital? What can you do as an elected member of the Iowa House to address these critical needs? Some have suggested funding for a program that would incentivize providers to practice medicine in rural areas. What do you think can and should be done? We'll start with you this time, Pat.
Yeah, so 2 years ago, 2 or 3 years ago, I apologize, as you asked the question, I knew I couldn't remember the exact year we did it. When I was appropriations chair, we added additional resources specifically for, I think there's about 80 to 82 critical access hospitals in the state. We added an additional amount of funding just for the critical access hospitals within the state. And those are basically a critical access hospital doesn't just mean it's in a small community. They also have an emergency room accessibility as well. And so we added additional resources for the first time, as far as making it a specific line item, in the first time in years that I can remember doing that in response to there being some concerns that are the impacts that are happening on our critical access hospitals, which we would have 2 in this House District 50. So that's the first thing, is we need to continue to put resources into the additional resources into those specific 80 hospitals, 82 hospitals, making sure they're having the resources available and resources necessary to stay viable. One other piece of that when it comes to the OB, I know, like in Iowa Falls, for example, I think Marshalltown, maybe a few other communities have had to close that. From my conversations with folks, it's kind of a combination of 2 things. There is the situation about the amount of dollars that are available, but also how hard it is, like you said, to make sure you can get the folks that can work there. If you're going to be, making sure they have the services that would be needed if there were to be something to happen at the facility during a delivery, also finding the doctors that can fill those positions. So a few of the things that we've done in the legislature this year is we've increased the amount of residency spaces for folks to practice in rural Iowa, and making sure that those students then would stay in rural Iowa, because it's hard for us to say, you do this, you will stay in rural Iowa. But one of the things that we can do, and we've got good feedback from, is if you do your residency in a critical access hospital or a rural hospital, you have a much higher likelihood of being willing to stay than if you would in Des Moines, or if we ship all of our students wherever they would go. So we've worked to require the university to have additional slots for rural hospitals, and making sure that we're having those folks do their practice and try to incentivize them to stay in those rural settings. And hopefully part of that would be that they enjoy being at those hospitals, and that would be a part of getting them to stay. But what I can say is we've been really trying to incentivize getting some of these residency programs to reach out and do, and not just incentivize. I mean, there's been a few instances where we've had to say, you will do this many. And so we recognize that as an issue, and we will continue to put dollars into our critical access hospitals. I think part of that ties into, and maybe we'll talk about this later, is making sure that we have development, economic development, and have folks living in our communities, not just moving to Lynn and Johnson and Polk County, but making sure we have some growth in our rural communities. So that ties back into that, to make sure there's the patients and the clientele to fill those needs. But that's probably for a different question.
All right. Thanks, Pat. And Dennis, I saw you dropped out there for just a second.
Like,
at the beginning of this question.
I heard none of your question.
Okay.
So if you want, I can talk a little bit about like the Grundy Hospital. I am a volunteer for the Grundy Hospital for the SHIP program. Mm-hmm. And, Grundy Hospital has a great reputation. They are rated #1 year after year for the services that they provide. And so it's an important part of the community of Grundy Center. And as a volunteer there, I think they do a great job of dealing and helping the community on so many different levels. As a SHIP counselor, what I've found though is, and this has nothing to do with the hospital, this has to do with the privatization of Medicaid and the effect that that's had on the communities. And knocking on doors, I've found as well that families are struggling that have kids with special needs.
We got Dennis back now.
He's back.
All right. All right. Dennis, I'm just going to read that question again. Well, let's go back. You didn't get a chance to fully answer the last question. Would you like me to read that one for you?
Sure, because I hadn't really heard. All I heard was hospital, basically.
That's fine. That's fine. We can edit out a little chunk here. All right. So many rural hospitals in Iowa are struggling to stay afloat. Inadequate reimbursements and changing trends in patient care have affected how critical access hospitals make money. As a result, services have been cut in many places. That's OB, forcing women in rural areas to drive an hour or more to access prenatal health care and deliver their babies. This affects the health of Iowans who live in rural areas, and it affects the viability of our rural communities who wants to move to a town that doesn't have a hospital? What can you do as an elected member of the Iowa House to address these critical needs? Some have suggested a funding program that would incentivize providers to practice medicine in rural areas. What do you think can and should be done? Take it away, Dennis. Oh, perfect. Lost him again.
Third one will be good.
Oh yeah, we'll nail it. We'll nail it.
Maybe it's that question. Why don't you just move on to a different one?
Hey, Dennis.
I don't think they want me to talk about hospitals.
I just told him it's time to move on. And then the follow-up question is, why is Pat Grassley so great? So that was the follow-up. You cut out for that one, Dennis. So go ahead. I'll back away.
All right. How much did you get that time, Dennis?
None.
None, really?
Yeah.
All right. I'm sorry, Pat. You're gonna get to listen to this one again. All right, you ready? Many rural hospitals in Iowa are struggling to stay afloat. Inadequate reimbursements and changing trends in patient care have affected how critical access hospitals make money. As a result, services have been cut. In many places, that's been OB, forcing women in rural areas to drive an hour or more to access prenatal health care and deliver their babies. This affects the health of Iowans who live in rural areas, and it affects the viability of our rural communities. Who wants to move to a town that doesn't have a hospital? What can you do as an elected member of the Iowa House to address these critical needs? Some have suggested funding a program that would incentivize providers to practice medicine in rural areas. What do you think can and should be done?
I think for the hospital wards, my wife used to be a Lamaze instructor in Cedar Rapids for many years. Part of the issue is litigation and the cost that goes with litigation for childbirth, and the issues and the risks that come with having delivery. And so I think the legislature needs to figure out a way of helping deal with the litigation side of it. It's as long as doctors cannot make a living by the time they had to pay their insurance rates that they have to pay, I don't see why a doctor would even want to take the risk.
All right. Pat, you had a chance on that one, didn't you? I lost track now that we've gone through that 3 times.
I heard the question enough. I decided I still like my answer. So.
Okay. All right. That's good. That's good. All right. Let's move on. This is the last scripted question that I have for you guys. And then I just want you to have a chance to talk about anything else that you think is critical for our House district and for the state. So, but first, has Iowa's leadership done enough to protect Iowans from the coronavirus pandemic? Do you think Governor Reynolds should issue a mask mandate? Why or why not? And what other steps can or should have been taken to protect Iowans' health and occupations? Pat, I'm going to let you take that one first, since you had heard it once before and had time to mull it. Go ahead. You can answer that question.
No, I've done enough of these in the last year that I'm probably better without thinking than I am thinking. So I'll probably botch this one. So to the specific question that was asked, I am supportive of Governor Reynolds' position to not issue a mask mandate. I would just point to many of the other states that have done that. If it was so effective, I don't know why there continues to be the level of cases that there are. I support the governor's decision. I will also say that I'm very thankful for the leadership that the governor has given the state and trying to approach this. And she just recently did this again as another example, approaching COVID in a way where you try to do it region by region, county by county, and try to do it in a way in which it's not just a one size fits all. Because I think whether it's K-12 education, road projects, whatever it isn't a one size fits all solution. Now, I will say this is something that there was no playbook for. No one, when I walked into the speaker role, no one left me a playbook on how to pause session for 2 months and then try to figure out how to bring it back. the same way that Governor Reynolds was had this thrown in her lap. But I think she's done a great job. And I think the number one priority and the key to this has been, and I will go back to when we put a pause on school districts, we put a pause on the legislative session, tried to figure out how school activities were going to go, tried to do that in a way where we consulted the experts here within the state, tried to take their advice and then implement that and hope that Iowans will follow it to the best that they can. Now, I can tell you that we all know that you could have a mask mandate. Not everyone's going to wear them. It looks like to me, businesses, here in the area that have a mask mandate, people follow those when they are asked to do so. I am very supportive of businesses' rights to be able to do that and enter into their private property. If you ask me to wear a mask, I have two choices. I put on a mask or I choose to go do business somewhere else. And just as recently, the governor, when the students came back to the three Regency universities, made the decision to close down some of the bars a little bit sooner in the evenings and shut them down to maybe where we didn't expect to do that. But she also did it in a calculated way where there was an increase in cases. And as they've come down, she's begun to adjust those accordingly. And I think that is how this has to be handled. I don't think you can just write in as of March, whatever, 16th, 17th, whatever day we shut down the legislative session and say, okay, mask mandate, everything's closed down, period. We'll see what happens. I think having to do it in a way where you can justify the decision that you're making as you're making it. Again, perfect example, closing the bars, reopening them as the cases begin to come back down. So that's probably a long-winded answer because I don't think there is a right playbook that was just given out. But what I can tell you is looking at what the governor has supported and what the legislature has worked on, bringing kids back into the classroom, I still feel very confident that was the right decision. Us coming back for the legislative session to finish our business the first week of June, I feel like that was the right decision. So as we look at the decisions, not only we're making moving forward that we can make looking back, I think that we've worked together very well with the executive branch and made the decisions that I think Iowans expected us to do in a responsible way.
Dennis, how do you feel about the way that the governor has handled the pandemic response, the governor and the state legislature?
I only heard a little of Pat's answer, but I happen to disagree on the mask. I think I'm 65 years old, so I'm in that class. I have a pre-existing condition, and I think that would be a simple thing for people to do that does not take anything away from them, but it protects all of us. And I think that the mask would have been a very easy way for her to have protected me and protected the people that I am around. And I don't understand why it has been such a big political issue. I think it's just a healthcare issue. It's no different than having car insurance on your car or any of the things that we have to do to keep other people safe. And so I think the mask, we should have worn masks. I wear a mask wherever I go.
All right. So I just really want to give you guys a chance. Those were a few brief questions, sometimes not so brief. I felt like I was reading for a while there on a few of them, but if there are other issues that you feel are critical going into this tenure that will be served in the Iowa House, talk a little bit about those and any other closing remarks that you might have. We'll start with you, Dennis.
In running for office this year, 2020 has been such a different year than 2018 was. In 2018, we were talking about the privatization of Medicaid. We were talking about opioids. The coronavirus has changed what we're talking about and how people are receiving what we do talk about. I know Pat disagrees, but I don't think that there is cooperation between the two parties. I don't see happening. And I think in order for us to solve the solutions of our state and satisfy both sides, nobody's ever going to be satisfied on both sides, but they should at least feel like they have a voice at the table. And as long as one party controls the entire process, we don't have that. And going forward, if we are going to look at our society and what we want our society to be, we have to be talking and sharing that, because when we, the people that I have talked to, so many of them say that they that they're concerned as no one's listening to on either side. I'm not saying the Democrats are any better than the Republicans at doing this. That's not what I'm saying. I'm saying that they need to come together. And I know this is not meant to be a political discussion, but when we look at the Supreme Court issue that's happening as of Ginsburg's death, what was accepted in 2016 and used as rules should be the same rules that are being used today. And so, and that's what people see. They see us saying one thing. I had one person I talked to and he said, okay, Mr. Evans, what is your feeling on sanctuary cities? And so I said, and he says, well, because you think that, you're going to vote the way the Democrats want you to vote anyway. And that, we've got to get away from that. We've got to start having people that are independent thinkers that can listen to both sides and come up with good decisions. It's the same with our television. You have Fox News doing one perspective and you have MSNBC doing one perspective, and the people aren't crossing over and listening to both sides and coming up with an intelligent conclusion there. And so if we want our society to be an effective society, we have to have discussion, and we have to figure out a way to communicate in a way that everyone feels that they're being represented. And that's probably the major reason I'm running, is that I feel like I have the skill to do that. And it's what I think is important for my grandkids to and my kids to feel that they're being represented that way as well.
Thanks, Dennis. Pat?
All right, if I go on for too long, go ahead and give me the cutoff, Tony, because
I will have to, because I have another one in 13 minutes. So
that's okay. I got to get on the road too.
I'll give you 5, and then
no,
I need to take a break
give
too.
me the cutoff. Okay, but so let me just say there. Number one, I think the most important thing, and this is something that every time I talk to any group right now, I talk about, and Dennis touched on, no one's listening, no one's working together. When I was elected 14 years ago, I came in as the minority party. There were several, what I would say, moderate Democrats that would listen to the other side. So everybody's going to say, well, you're speaker for the Republicans. Clearly, you're going to say that, Pat. That's what your response is going to be. We had a bill when we came back in June, which was a COVID liability protection bill. That bill was about protecting our Main Street businesses that wanted to reopen in a responsible way, whether it was requiring masks, limiting how many people could be in the store. But there was some unease that they didn't feel that they could reopen without having a bunch of trial attorneys coming from each coast to sue every one of them. So that was brought to us by Iowans, not Republicans or Democrats, but Iowans, churches, county fairs. Can't believe all the county fairs I heard from, schools, businesses. That vote came up before the House. Every Democrat voted no. Every Republican voted yes. When I was elected 14 years ago, I feel very confident in saying that that was a vote that would have been a bipartisan vote. And I think it's one that I point to say that there is clearly a distinction in what you're going to get under the leadership that we've displayed in the House for the last 10 years and what you're going to get from the other side. Now, I appreciate hearing from Dennis that having individuals that would be independent thinkers, but I can tell you right now, we don't see any of those when it comes to a day-to-day basis and the votes that we take. Again, COVID liability, a partisan issue. We wanted to add an additional a little over $2 million for our state troopers within the state. Every Democrat in the House voted no. And so I use those as examples where I wouldn't say that we're not listening and not talking, but those are two issues that I think are important enough that I'm willing to fight for. And I don't look at something like that as there being a lot of common ground. And it is very frustrating that there isn't more from the other side, where there'd be some moderate and some willingness to want to work on issues together. And then I would say, looking forward, and why I would want to humbly ask everyone in House District 50 for their vote. And that is one thing that I do on a daily basis when I go to the legislature. And now that I've been elected speaker, I feel like I'm in a position where I can have significant influence on what the legislation looks like that affects House District 50. I've always been able to whether because I've been a committee chair for several years, but now I'm in a position where I can push forward things that I think impact rural Iowa and House District 50. A perfect example, that would be a bill that I have been working on for the last several years, which would basically require a certain percentage of the incentives used at the state level to go to rural, the 88 smallest counties. That's about half the population within the state. And I actually came up with that idea based on what we see in Iowa Falls being a perfect example. You have a community college, good infrastructure, you have available housing, could use more obviously, but have available housing, also located right on Highway 20. So I look at those as a perfect example of the kind of communities that can be hubs that we need to incentivize growth to happen, because if Iowa Falls succeeds, Alden succeeds, Ackley succeeds, Steamboat Rock, Hampton, all those surrounding communities. So without going too far in depth in what that bill does, I've been trying to get incentives that are distributed in a way that it's fair to the large counties, the Polk counties, the Lynn counties, the Johnson counties of the world, but also House District 50 and other legislative districts like it have that seat at the table, because we don't have these huge economic development teams. I think in the entire district that I represent, there maybe is 4 individuals that focus on economic development at the city and county level. And so my point being in all that is recognizing what those issues are. And I think growth is one of the most important issues that can happen for a district like House District 50, and having a seat at the table and making those decisions, I think puts me in the best position to be able to impact that and make sure that the districts like ours have a seat at the table, and not every decision is just being made in Polk County, which it's far too often is the case. And so with that, again, it's been a great opportunity for me to get to represent House District 50 over the last 10 years. Would love the opportunity to continue to do so, and know that when I go down there on a daily basis, the issues that I'm working on are ones that I'm hearing from the folks in the district, and trying to make sure have a seat at the table, whether it's at the House table, the Senate table, or the governor's table. And I feel like I've done a good job of that. So again, I would just ask for your vote and appreciate the time today, Tony.
I appreciate both your time. Thank you so much for doing this. Thank you for fighting through the technical issues with us. We wanted to do this because it's a difficult time for you guys to get out and shake hands and talk to people directly. That said, if you are in our neck of the woods before the election, make sure you let us know, because we want to come out and see you. And I would just thank you guys again. I really appreciate it, and always enjoy talking to you both.